Hello, I'm Dr. Abhinav Tyagi, a senior physiotherapist and chiropractor at Physiotherapy Clinic Noida. I've been working here since last 11 years and I've gained extensive experience in treating with musculoskeletal pains like primarily neck pain, knee pain, low back pain, sciatica, headaches, and I believe in dealing with precision with postural care and nutritional deficiencies, vitamin deficiencies. I have passed my graduation from University of Delhi. Usually people, in fact most of the people, everybody, they ask, why do I have neck pain? Why am I suffering of the neck pain and what cure do you have? Can you cure me? This is the questions we face every day. So the answer to that is, your neck pain, the cause of your neck pain is multidimensional. It is not just one cause, it's usually multidimensional. It comes from many dimensions. Even your emotional stress, that's one. Your work stress, that two. All these are your contributing factors. And your postural stress, even the chemical stress, the food we eat, that also has a contributing factor towards a neck pain. So even your I would say, although I don't address to it, but even your spiritual matters, they can also cause or heal your neck. They have a contribution towards it. So as I told you, 5 causes, I would say yes, the treatment should also be multidimensional, and all these dimensions should be addressed in the treatment part also. So what about the postural part? Postural part, as I've told you, we will guide you through the all the postural cares, do's and don'ts that you need to do. The chemical part, the food part, yes, we take special care of the food part also. We advise our patient on the diet plan that he should be following for his musculoskeletal and neck pain to get better faster. So Nidhi has been having neck pain since 6 months. And there are many people in offices who suffer the same agony and pain in their office. If not pain, then they feel some type of discomfort during the day. Maybe it's higher or lower, but they don't feel that their neck is normal. They feel something is troubling them all the time. So why does it happen, and why does almost 4 out of 5 people working in the office for more than 8 hours develop these type of pain? So similar to Nidhi, due to the long hours of sitting, some structures gets shortened. Their flexibility reduces, and that is the result. They start creating some discomfort. Then the time of the discomfort increases, the magnitude of the discomfort increases, and then eventually it shows up as pain, and then more pain, which you can't bear. So how does it happen and how can we reverse it? We'll just cut it short. So body has a tendency, body has a pattern of flexibility, and body has a tendency of going into a bad posture. So what is the tendency? So there are some structures here, we call them occipital muscles. These, about 2 inches, these are the occipital muscles, both on the right and left, and they have a very strong tendency to get short. They have a tendency to become tight, and when they become tight and short, they usually start giving symptoms like headaches, even vertigo, pain, discomfort, and even mood swings. So there are a variety of n number of symptoms they will produce. So these structures become tight. So primarily we need to improve the flexibility in this region. We call it C1, C2 hypomobility. So we work on this region. Then there is this thoracic region which becomes tight, because we sit like this in a forward-headed posture and it becomes tight. So we work on the rhomboid muscles, the scapular blade, the blade muscles become tight, we work on those. Because if you see neck pain, it also involves the shoulders. Usually the patients with chronic neck pain, they start developing the shoulder pain also. And it's a pain which keeps on spreading. It never stops to one area, it spreads. It will start going to the head, it will refer to the head, forehead, it will go down to the arms, forearms, and then hand. So, but yes, if the discomfort is not developing into pain, exercise primarily will not go into resolution very soon. You need treatment. So at Vikal, we concentrate the treatment on these areas. This hypermobile area here, this hypermobile area, this hypermobile pelvis, and the foot. So now I will demonstrate the techniques of mobilizing these areas and some things that you can do at your place. So first I will demonstrate on Nidhi how we plan the treatment, how we design the treatment. Because treatment is not just about heating, it's a combination of many things. Okay, Nidhi, you lie down on your stomach and face this side. So Nidhi has come for neck pain. Nidhi, her chief complaint is neck pain. That is her primary complaint. There must be many other things which are happening, because as I just told, there is a pattern of stiffness which develops. As she has developed neck pain, she will soon develop low back pain also. She will soon develop hip area pain also. So a good treatment is a multi-dimensional treatment. It will work on all the stiff areas, right? So first we'll mobilize the thoracic area. So when we mobilize the thoracic region, we mobilize both the muscles and the joints. So for joints we use chiropractic manipulations, which are some. Very good. Okay, and then you comfortable? The human body is like a spider web. Anatomically, everything in the body, the bone, the fascia, skin, everything is interconnected. Anatomically, nothing is separable. So, if you have neck pain, then you are about to have low back pain also. Then you are about to have calf pain also. So, living with neck pain or low back pain, then eventually the whole body has a tendency to have pain. So whenever we treat chronic pain, whenever we treat pain which has been there for more than 3 months, we understand that the pain has spread. It's like a fire, and the fire grows. So the pain also has a tendency to grow. The musculoskeletal planes, they grow. So we need to work on all the tissues, all the joints, and have a more holistic design to the treatment. So to achieve the same, we begin mobilizing with the foot. Okay, now turn. Comfortable? If the foot is hypermobile, so these are the PRPs and DIP joints of the foot. So if the foot is hypermobile, it will affect the knee, it will affect the low back and even the neck. So So we have mobilized the foot, we have mobilized the knee, we have checked now we'll check the mobility of the hip joint. The hip is good. Now we can mobilize the spine. Turn to my side. Lie down straight. And the most important part, we use a lot of wedges. We encourage our patients to use wedges. These are the wedges, they come in a variety of shapes. So again, so they increase the lymphatic flow, which is required again for a more relaxing and a more rejuvenating experience that the patient can have. Even at home, they should use it after doing exercise, doing marathons. This is a good idea because the back flow in the veins in the calf is not very good, and as the age progresses, the valve don't function very well. So these type of wedges which elevate your calf is a very good idea. And these are available on Amazon and everything. So, okay, now we'll do this is the favorite part of my treatment. We'll do the cranial-based release. Lift your neck up. Now we'll work on the tight occipital muscles. As I told you, these are the tight occipital muscles which becomes responsible for headaches and vertigo, dizziness. And when they produce headaches, they refer pain and headache on this region, on the forehead muscles, the eyebrow muscles, the auriculoobli. So now we'll mobilize them. You can even mobilize the sternocleidomastoid muscle. We can mobilize the forehead muscles. Mobilizing the forehead muscles has an immediate impact on the neck pain. Because it lowers down the overall tension. It lowers down the overall emotional tension that the patient experiences. And pain is not just pain, it is a mere emotional disturbance that the patient feels. So mobilizing the face muscles has an immediate impact on pain and headaches, yes. Even the intuition. This is the corrugator muscle. We also call this muscle the depression muscle, the tension muscle. The patient must relax. We also add a gentle traction to these techniques. As the age increases, degeneration also begins at C6, C7, C1, C2 level. So gentle traction always helps. At the same time, keeping care that the blood flows improves, the blood flows back to the heart, and same with the hand movement. We'll mobilize the hand. This is followed by effleurage. Again, very important for the patients who have neck pain. The forearm muscles and the arm muscles should be taken care of. As I told you, they are all connected. You work on the hand, you find relief in the neck. You work on the neck, you find relief on the low back. You work on the calf muscles, you find relief from the low back. They are all connected. So for a faster recovery from pain, the overall body should be treated, not just the area of the pain. This. Perfect. This is Tekar therapy. This is a revolutionary heating equipment that we use at Vikal to relieve the painful and the tight areas. This is a radio frequency cream that we apply. The patient experiences a mild warmth when this is being done. Extremely relaxing, very soothing, and results in a great flexibility of the chronically tight structures. Again, it is a two-hand modality. Another hand is used to feel the tight structures and mobilize them at the same time. Further increases the effectiveness. So without Tekar therapy, it used to take a lot of sessions. What we achieve these days in a single session, it used to take around 5 to 6 sessions to achieve the same results. And not only the Tekar therapy has increased our speed of recovery, but also the most difficult to influence pain. Tekar therapy has made it very easy for us people and for the patients. Both have benefited the Tekar therapy tremendously. So we have been using Tekar therapy for the last 3 years, and it has been great. Here we target the tissues we want to heat. We can target them, unlike other heating modalities where we can't target the tissues. For these type of neck pain and body pain that most of the people in offices suffer, we usually recommend them the clinic visit, not the home visit of physiotherapy that people usually look for, as it's very convenient. But we do recommend coming to the clinic because you can totally relax in this environment and let your body heal, let your body relax, because only in a relaxed environment your body tends to heal itself, which is important, because fixing these neck pain and back pain is not just can't be done with just the exercises. At times you need a total body treatment where your muscles can be 100% relaxed, and you find a peaceful atmosphere. You find similar people like you undergoing the treatment on the same roof. That is a feeling which let the body heals very quickly. So better you should come here, give us a chance, and we'll do the needful. So many patients who come to us, they are actually seeking chiropractic treatments, and these chiropractic adjustments that they seek, most of the time that they come, they are in a lot of pain. Their situation has worsened and there is a lot of nerve compression, but they are seeking some miracle cure for their condition, and they have a notion that we'll do some cracking, we'll do some popping sound, and their disc will go back, they will immediately get better. So I want to do some correction there. It's a thought correction. I want to tell to everybody that that is not the case. You need to go in a very systematic manner in diagnosing your condition, in diagnosing your root cause. So people who usually have neck pain, we always recommend that they should first undergo an MRI, find out the level of compression, find out the degree of your disc damage or the degree of your disc degeneration, and not just about seeking a one session treatment. So here we have put up a chart. So people who are trying to search the magic bullet, I'm sorry to say, but chiropractic is not a magic bullet. It won't cure your condition no matter what. There are limitations to it. There are limitations to chiropractic. So, and in fact, when done wrong in wrong hands, it can even damage your case. So, for patients who have pain running down the arm or running down the leg, we call it sciatica. That's a degree of nerve compression that you have. There, the chiropractic, the rotational manipulation, the cracking, that should be avoided. That should not be done. that's a contraindication to your chiropractic manipulations. So we have a very systematic plan to manage these type of conditions. So I request people not to find the magic bullet, and not to do it themselves also. A lot of people, they start doing their neck like this, and they think, seeing the YouTube videos, they think they will apply the same treatment, or somebody else in their house or in their friend zone will do the same cracking sound, and their problem will be over. So again, I want to warn people that that is not the case. That is certainly not the case, and you need to have a management plan when you have pain. Not the cracking sounds won't help. They might make you feel better for a while, but that is not the solution to the problem. And professional help should be, you should seek professional help when the pain starts radiating down the limb. And in the end, I would like to inform everybody, the videos that we usually see on YouTube, those cracking and the patients becoming all right in just a single sittings, I would like to share it with you. Like, beware of these videos. They may be fake videos. The patients may be fake, the conditions may be fake, so you should not trust them. So let's conclude. If you have pain, if you have low back pain, neck pain and myalgias in the back, so how to go about it? Take good care of your posture, that's first. Take good care of your diet. Be emotionally strong. You should be emotionally more stable. Emotionally more stable people get out of pain very fast. When at last, if you still feel the need of help, then you must take professional help.